All right, good morning, guys. I'm running a bit late today. I had like an emergency doctor's appointment I had to go to with my son this morning. Everything's fine, but I just didn't have a chance to do the attendance codes this morning, so everybody will get credit for being here. I just didn't have the time this morning, so no attendance codes today. All right, so this is going to be our last lecture period. Your exam number 4 is on Wednesday. Don't forget about your exam on Wednesday, and your McGraw-Hill Connect assignments on Wednesday are also due by 11 a.m. on Wednesday. And then on next Monday, we have the optional final. Again, you don't have to take the optional final. It replaces your lowest test grade. So if you're not happy with your grade or you want to try to go for the next grade up, you're welcome to take the optional final. The optional final is in this room, normal place and time. I don't think there's anything else to say about it. You don't have to do anything if you want to take the optional final, you just show up. Okay, so you don't have to email me or let me know or anything. If you have questions, again, I'm going to get your test graded just as fast as I possibly can. I'll stay up all night on Wednesday getting them graded. So I'll get them graded as fast as I can. But if you have questions about your grade or if a certain grade is possible, you are welcome to come by my office. I will have office hours basically all day on Thursday because I don't have labs anymore. So I'll be in my office basically all day on Thursday and basically all day on Friday. So if you have questions, you want to come by my office, you want to look at your exams, you're welcome to do that. Just stop by my office. Pretty much like, probably 9 to 3. I'll be there most of the day, but you're welcome to email me if you're not sure I'm going to be there. All right. Any questions about any of that? Okay. All right, so we're just going to finish up chapter 19, and then we're going to do chapter 21, and so hopefully we will be done by the end of today. So we're talking about respiratory infections. We're just finishing up the last little bit of respiratory infections, and this influenza is probably the most well-known of the respiratory infections, maybe after the common cold. But influenza is caused by influenza viruses. And there are many different influenza viruses. We tend to categorize them into A, B, or C. A tends to be the most severe. And then it goes down in severity from there. So A is the most severe, B tends to be less severe, and then C tends to be the least. So A is the most, C is the least. But there's also a lot of subtypes when it comes to influenza. Like if you've ever heard of influenza H1N1 or influenza, there's lots of them. H1N1, H3N8, these are all different substrains of influenza. And the influenza virus is one of the more deadly ones, and it can cause a lot of issues because it mutates very quickly. These H and N genes mutate and create these new strains that our body then doesn't know how to fight off. Okay, so these new strains are what cause a lot of the issues. And you can see in this chart the deaths attributed to these new strains in each of these years. So this doesn't include baseline deaths of influenza in these years. This is only deaths from new strains, and it's the new strains that tend to cause us the biggest problems. For example, the 1918 flu pandemic, 50 million people died worldwide from this strain of influenza alone. And that's because that H1N1 was a new variant that year. And nobody's body knew how to fight it off. Nobody had any immunity to it. Nobody had ever had it before. It was a brand new virus, similar to like COVID-19 was a mutation and a brand new virus, which is why it swept across the world and caused a global pandemic. And every couple of years, we get these new substrains. I think this was 2009. I don't think any of you guys were alive yet. But in 2009, oh yeah, you were. I'm sorry, I'm doing my math wrong. I don't know how old I think you are. You guys were alive, but you were young. 2009, there was another new strain of H1N1. It was known as swine flu. That was the year known as swine flu. And not as many people died, but between 18,000-ish people died from this strain alone. So the flu vaccines or the flu strains can be really dangerous because they mutate so fast. Because they're spread across the world, they mutate, they change, and then nobody has any immunity to any of it. And it can be quite dangerous. Signs and symptoms of the flu, most of us have had the flu before, but the big symptoms associated with the flu are going to be the body aches, the fever, and the extreme fatigue. Those are the big 3 signs/symptoms associated with the flu, specifically the fever and body aches. And if you've ever had the flu, you understand that extreme fatigue. It's not just like when you have a cold or something like that, you're tired and a little achy, whatever, but the fatigue that comes along with the flu is something else. Like it lasts for weeks. A lot of times people find it really hard to get out of bed for a couple of weeks after they've had the flu. It just completely wipes your body out. And it is spread through droplet and direct contact, just like all the other respiratory viruses, or most of them. And it can be prevented with yearly vaccines. However, we do have to have yearly vaccines for these because of the frequent mutations. And we've talked about this before, but one of the big problems with the flu vaccines are these frequent mutations. And because these yearly vaccines take about 10 months to produce, the flu vaccines are honestly always behind the times. If a new flu variant were to show up today, with the current technology we have, it would take 10 months until they're able to develop a vaccine against that particular strain. So that's the biggest downside of our flu vaccines, is every year when you get a flu vaccine, what you're getting is a vaccine that's based on a lot of guesswork from the year before. So we just passed flu season, right? Or we're still in the middle of it, but we just got kind of past the middle of flu season for this year. They've already started developing the vaccines for next fall. They have already started to make them because it takes 10 months for them to grow and be purified and created. And so a lot of people who are a lot smarter than me get together and they decide which strains they think are the most likely to show up in the next flu season. But they don't always get it right. And so that's partially why some flu seasons are worse than others. This year's flu vaccine didn't cover the primary strain. That's why this year's flu season sucked so bad, was because one of the strains that was big this year wasn't covered by the vaccine. Because it's all a big guesswork. So you can see how when you compare this to the COVID-19 mRNA vaccine, the mRNA vaccine takes a couple of weeks. So when COVID-19 mutates and a new strain becomes available or a new strain becomes big, it takes like 2 or 3 weeks before a new vaccine is available. And that's a big difference. So the flu is absolutely still we've had vaccines for it for years, but because it mutates so quickly, it's still a very large problem. I just looked up before class, and the numbers say that in the 2024 to 2025 flu season, so the last completed flu season, about 5,000 people in the US died from the flu. So the flu is not a zero problem, even if you get the flu vaccine. Vaccines help, for lack of a better term, they help people not die from the flu, but they are not foolproof. And it is a lot of guesswork. And so sometimes the flu vaccines just don't work. Okay. And then our last one is respiratory syncytial virus. Respiratory syncytial virus is also known as RSV, which is another respiratory virus that's very common during flu season. And the causative organism is also respiratory syncytial virus, or RSV. And the big signs and symptoms of RSV are a lot of those flu symptoms, so fever, runny nose, cough, things like that. But the big thing with RSV is this, the difficulty breathing and the chest retractions. What a chest retraction is when you look, and this is most common in infants, but what a chest retraction is when an infant in particular is struggling to breathe so hard that like the skin around their ribs sucks in. So like you can see their ribs because the skin is like if I go, right, and you can like feel your ribs when you do that and you suck it in. That's what it looks like when somebody's trying to breathe with this, because their lungs are so congested and they can't breathe that it's sucking in their ribs. That's what a chest retraction is. So if you ever have an infant, or if you're ever around an infant and they have a cough or something like that, the chest retraction is a big sign that they are in danger and that they need to go to the hospital to be taken care of. And transmission, again, droplet or direct, it is most common in infants under the age of 6 months old. Okay? Adults can get RSV, but for a lot of us, it's just not as bad as it is in infants. A lot of us can get RSV and not really know we have anything. We think we just have a cold, right? We just have a runny nose, maybe a little cough. We assume we have some virus, whatever. But in children under the age of 6 months, it can be very, very deadly. So there is a vaccine available for RSV, but unless I am mistaken, I think that the last time, at least when my son was little, 9 years ago, you couldn't get an RSV vaccine until you were 6 months old. So I don't know if they've changed the rules. They may have. I'm not up on all the vaccine schedules, but you used to not be able to get an RSV vaccine until you were about 6 months old. And so children under the age of 6 months are the most susceptible to this because they cannot be vaccinated. Okay? But again, the big thing with the RSV is it makes it very, very difficult for the patient to breathe. It can cause those chest retractions, difficulty breathing, short, fast breathing, things like that. Treatment for RSV, there is no effective cure for RSV. The only thing that you can do for RSV is supportive care. And for infants under the age of 6 months that have RSV, a lot of times that means having them in the hospital. Sometimes they have to be ventilated, means they're put on a respirator. Sometimes they need supplemental oxygen, just to support their body until their body can fight off the virus. All right. Okay, so that's the end for chapter 19. Sorry. Buried the lead there. Okay, so now we're moving on to chapter 21, everybody's favorite chapter. We get to talk about genitals today. And I do want to say, so we're going to be talking about sex, and we're going to be talking about penises and vaginas a lot today. And I do joke around about this a little bit to try and keep it a little lighthearted. I found that students remember it more when I say vagina a lot because it's so shocking to hear that it makes you remember it more. So I am going to joke around about it a little bit. I do assume a certain amount of sex education on your part. But what I want to say before I get to the joking and kind of laugh it off is that if I ever talk about something that you don't know, right? Like I said, I'm assuming a certain amount of sex education, but not everybody has that. So if we start talking about something that you don't understand or you don't know what it is, I promise that you can come to me and I will not make fun of it, okay? I'm not going to make light of it and joke about it in that situation. So if there's something that you don't know about or you're confused about why I say that, because we are going to talk about sex and things like that today, that you can always come to my office and ask me, and I promise that I will not make light of it or joke about it. I make light of it and joke about it a little bit in here to kind of keep it funny and light, but if you come to me because you have a question about something and you don't know who to ask, the internet didn't tell you, you can always come to my office and I promise I will answer without laughing, I swear. Okay, all right, so today we're talking about infectious diseases affecting the genitourinary system. Now, genitourinary system is actually two separate systems. We have the genital system and the urinary system. So the urinary system is how we get liquid waste removed from our bodies, right? Our bodies have liquid waste and solid waste that we have to get rid of. The urinary system is how we get rid of the liquid waste. The genital system is for sexual reproduction. Okay. It's how humans have sex, and it's how humans birth babies and reproduce. Okay, so this is actually two systems. They just happen to be in very, very close proximity. And in one of the genders, they are actually one system, but we think about them separately. So we'll get to that in just a second. So the anatomy of the genitourinary system, we're first going to start off talking about the urinary system. Okay, so we have two different anatomies here. We have the genital system anatomy and we have the urinary system anatomy. So this is the urinary system anatomy. Urinary system is composed of kidneys, bladder, and then a urethra. The kidneys are what filter the blood. So the kidneys are what pull everything out of your bloodstream that shouldn't be there. Excess water, electrolytes that you don't need, drugs, any kind of metabolic waste products, urea, which is a waste product of human food metabolism, or any other liquid waste that needs to be gotten rid of will be filtered out by the kidneys. What's left behind will travel down the ureters and be stored in the bladder. And the urine is the liquid waste, and it is stored in the bladder. And then when a person goes to the bathroom, the urine is released from the bladder and exits through the urethra. Now, the thing about the urinary system is if you just look at the urinary system like this, the urinary system is just about identical between males and females. Okay, males and females do not have a difference in their urinary system. We all have two kidneys, we all have two ureters, we all have one bladder, and we all have one urethra. There is one slight difference between male anatomy and female anatomy, and the difference is in the urethra. Male urethras are longer. Female are short. Okay. And the reason for that is because the urethra in a male goes all the way through the shaft of the penis and comes out the tip of the penis. And the female anatomy is held close to the body. And we'll talk more about that later, about why that means that females are more likely to get infections than males. But again, everything else is the same. Even the structure of the urethra is the same. It's just that in men, it's longer. Or males, it's longer, excuse me. Males, it's longer. Females have a shorter urethra. Okay, so that's the urinary system. It's the same. The difference comes in when we're talking about the genital system, right? So males, genetic males have a penis with testicles, and females have vaginas with uteruses. Now, the biggest thing here is that in genetic males, the genital system and urinary system share an opening. Okay, so in males, the genital part, the sexual reproduction part of a genetic male is to produce semen that is then ejaculated from a penis, right? And semen is ejaculated from the same place that urine comes out of. So men only have one opening, or males only have one opening. They have a urethra, ejaculate, semen, reproductive stuff, and urine all come out of the same place, okay? In females, there are separate openings. So in females, I'm trying to look at this picture. This is the urethra right here. This is where urine comes out. right? We have a urethra, but where ejaculate goes in and babies come out is the vaginal opening. Okay, so those are two completely separate openings. They're very close together, and they are together within the vulva, which is the external genitalia of a female, but there are separate openings. The vagina and the urethra are separate, okay? And you can see here in this picture that the urethra in genetic males, again, goes all the way through the penis, and genetic females, this is the bladder and this is the urethra. So you can see that the urethra in genetic females is much, much shorter. Another thing to keep in mind is that the urethra of males is held away from the body. Again, because the opening is at the head of the penis, it is held away from the body at the end of the penis. In genetic females, the urethra is contained within the vulva. So it is close to the body, it's flush with the body, okay? Female urethras don't stick out or hang away from the body. They're flush with the skin of the body, they're flush against the pubic bone, and they're encompassed within the vulva. Now, one of the reasons that this is really important is because of normal flora. So the entirety of the urinary system in both males and females should be entirely sterile. That means that there is no normal flora, or there's not supposed to be normal flora in the urethra, bladder, ureters, or kidneys. There's not supposed to be any bacteria in any of those. And we talked a lot about how, not a lot, but when we talked about the immune system, we talked about how urine is an acidic substance and it mechanically removes things from the urethra. So the flow of urine through the urethra and the acidic nature of urine keeps the urethra sterile. Okay, so the urethra is supposed to be sterile, and the urine flow helps that happen. Now, the difference is because genetic males share an opening, that means that their genital system is also entirely sterile. So the male urethra is always entirely sterile, or it's supposed to be. Okay. However, genetic females, the genital system is absolutely not sterile. So the vaginal opening and the uterus have normal flora, particularly the vaginal opening. The vaginal tract has a large amount of bacteria that is supposed to be there. In fact, the health of the vaginal opening is maintained by the bacteria that live there. Without the bacteria living in the vaginal tract, genetic females would be much, much, much more prone to infections. But what this means is that the entirety of the vagina and the vulva, which is the outer part of a female, is covered in bacteria, okay? And if all of that is covered in very normal bacteria, it's being held very, very closely to a part of the body that's not supposed to have bacteria, right? So in a vaginal opening, you have a urethra up here, you have a vaginal tract down here, if all of this has normal flora, but that one little urethra is supposed to stay sterile, it's much harder to keep that urethra sterile because it is surrounded by bacteria. Okay? Completely normal bacteria, but the bacteria is not supposed to go in the urethra. Okay? So that's the difference there, is that genetic males, their urethra is supposed to stay sterile, and there's not really a lot of bacteria around it. It's held away from the body. It doesn't have a vulva. There's nothing that has a normal amount of bacteria around it. The only thing around the urethral opening of males is a little bit of skin. Okay. So that's the big difference. Again, the urinary system is just about identical in both males and females. It's the genital system where we have a difference. All right. Okay, so by far the most common type of infection that is going to, let me make sure I said everything I wanted to. And then the other part of that, I guess I insinuated, but I don't know if I said out loud, is that because the female system has 2 separate openings, the vaginal tract does not have urinary flow, right? So there's no urine coming out of a vagina. There's not supposed to anyway. And so that means that it doesn't have normal urine flow to keep bacteria out, because a vaginal opening is supposed to have bacteria. Right? So again, by far the most common type of infection in the genitourinary system is going to be a urinary tract infection. I would argue to say data on this is basically impossible to collect, but just based on my anecdotal evidence of working in a hospital that collected all types of samples, I would go far as to say that urinary tract infections are the most common type of infections across adults, period. It may be tied with like skin infections, but urinary tract infections are incredibly common. When I worked at the hospital, we would diagnose, I'd say on average, like 25 a day, just from the patients in the hospital. And St. Francis is not that big of a hospital. They're incredibly, incredibly common. And there are several different types of urinary tract infection. UTI, which is what we kind of collectively call this, right? A UTI. A urinary tract infection can be any infection of any part of the urinary tract. Okay, so it is possible to have just urethritis, which is an infection of the urethra. You can have cystitis. This is the most common type right here, is cystitis, which is also known as a bladder infection. You need to know both of those terms. It's when the bacteria manages to get into the bladder. You can also have a ureter infection, or it can go all the way up to your kidneys and cause a kidney infection, which is known as pyelonephritis. Okay? And all of these, again, collectively are called urinary tract infections because they're infections of some part of the urinary tract. Now, like I said, bladder infections are by far the most common type of genital infection. They are much more common in females, genetic females, than they are in males. And typically, the symptoms of this, especially cystitis, are going to be urinary frequency, means you should have to pee a lot. It's going to hurt. They usually describe it as like a burning when you pee. And then dysuria, which means no urine. So you can have one or both at different stages of this infection. Sometimes it means that you pee a lot. Sometimes it means that you don't pee at all, depending on where the infection is. But the urinary frequency and pain in the urethra and bladder are big, big symptoms of cystitis. And typically, cystitis is what we call an uncomplicated infection, meaning that if you go to the doctor and you get antibiotics, it will be cured and goes away pretty quickly in a couple of days. It's usually treated very easily with over-the-counter antibiotics and isn't usually a big deal. However, the vast majority of cystitis cases do require antibiotics. No amount of cranberry juice or Gatorade or anything else is going to make it go away, for the most part. I'm sure that there's been, somebody who's done this, but for the most part, there's a myth or a rumor that if you drink a bunch of cranberry juice, it's going to make your urine extra acidic, and that's going to stop the bacteria from growing. That's not usually true. So if you have symptoms of cystitis, it's really important that you go get antibiotics, because if the bacteria spreads up the ureters and causes pyelonephritis, that is a much bigger problem. Your kidneys are very, very close to your bloodstream. And so if the bacteria get up into the kidneys, it's very likely that the bacteria will get into the bloodstream. It can cause sepsis and death. Okay, it's a very serious thing. So if you have a bladder infection, cystitis, it's really important that you get it treated and don't put it off and don't try to cure it at home, because if it spreads up into the kidneys, it is a life-threatening situation. And the big symptoms of pyelonephritis, so cystitis usually doesn't cause a fever. Cystitis is usually pain in the urethra, burning when you pee, and urinary frequency. But if the bacteria manages to get all the way to the kidneys, a lot of times that will induce a fever. And then the biggest symptom indicative of kidney infections is back pain, because that's where your kidneys are. Your kidneys sit about there, right on top of your hips, kind of right below your rib cage. And so if one or both of your kidneys is inflamed or infected, you can have one-sided, sometimes it's called back pain, sometimes it's called flank pain. Flank is a weird word, but flank pain. So if you have cystitis and you end up getting back pain on one side or both sides, again, it's very important that you go to the doctor. It's a very serious infection. Okay, and this is what urine, one of the biggest other signs, I guess, of urinary tract infections is changes to the urine. So normal urine is either going to be clear or maybe slightly cloudy. Especially if you are a genetic female, there's just more skin around there and skin cells can get in there. And there's also discharge and other things that come out of the vaginal tract that can get in the urine. So it's normal for genetic females to have slightly cloudy urine. However, infection will cause that urine to become very cloudy or very cloudy. And you can see that this urine over here, you can't see through it at all. This one, you can kind of see the reflection through the urine. And I have seen the worse the infection, the cloudier the urine gets. And I have seen infections where the urine gets so cloudy that it's actually like thick. It becomes like snot, which I know is disgusting, but it can get like viscous because there's so many white blood cells and bacteria in there that it can cause it to become cloudy and viscous. Okay, and there are lots of different bacteria that can cause urinary tract infections. Really, anything. Any bacteria that gets into the urinary tract can cause a urinary tract infection. The most common bacteria are going to be Escherichia coli and Proteus vulgaris and other GI bacteria, so gastrointestinal bacteria. And the reason for that is because most of the time, urinary tract infections are caused endogenously from the GI tract. And what I mean by that is bacteria that is normal in the GI tract, endogenous bacteria, makes its way from the GI tract to the urethra. Okay? And the way that most often happens, again, if you look at genetic females versus genetic males, look at where the urethral opening, so this is the GI opening, right? That's the anal opening in a female, and this is the urethra. Look at how close those are together. And then in genetic males, here's the anal opening, and here's the urethral opening, right? The urethra, again, is held away from the body in genetic males. It's at the head of the penis, and it doesn't really come in contact all that much with the anal opening. In females, the anal opening, the vaginal opening, and the urethra are all very close together, and they are held, they're kind of encompassed by the vulva. So they're all very close together, and it's really easy for bacteria to get from the gastrointestinal tract, particularly in genetic females, to the urethra. And the most common way this happens is through sexual activity. Okay, because during sex, there's a lot of movement, right? Things are going in and out of places. It's very easy, and I know it's kind of gross to think about, you think about stuff from your GI tract getting to places where it's not supposed to be. And I'm not saying that I'm trying not to be gross about this, but I'm not saying that there's like poop coming from the GI tract and getting into the vaginal tract and things like that. It's a small amount of bacteria. Remember that bacteria when they're by themselves, can't be seen. And all of us have bacteria all over our bodies, okay? It's very normal, unless you've just sterilized the outside of your anal opening, it's very normal for there to be a small amount of bacteria on the outside of the anal opening. And you introduce a penis to the mix and a lot of movement, mouths maybe, I don't know, hands, everything is moving from place to place, right? It's really easy for the bacteria to move from one place to another, okay, right? So I promise you guys are never gonna forget me saying that, right? Anyway, so it's really easy for bacteria to get from one place to the other. And that is by far the most common cause of urinary tract infections, particularly in females, is sexual activity. Which is why they always tell you, if you didn't know why your health teacher told you to do this, this is why it's really important that if you were a vagina owner, that you go to the bathroom after you have sex. Because that urine flushes anything that might have gotten in there right back out, most of the time. Any bacteria that got forced up there because of movements that may have been happening, right, is gonna be washed right back out with all that urine, okay? And it can also happen through decreased urine flow. So if you're dehydrated or you have a medical condition or something like that that makes it so that you don't pee as often as you should, you are at higher risk for urinary tract infections. So most urinary tract infections in males actually happens when males get quite a bit older, because it's a very common thing in elderly men that they have enlarged prostates, which can block the urethra and makes it hard for them to go to the bathroom. And so the decreased urine flow means that they are more prone to urinary tract infections. So if you are a sexually active female who's constantly dehydrated, you're more at risk for urinary tract infections than anybody else. Okay, you can also have this due to wearing clothing that's too tight, especially things like bathing suits, like wearing bathing suits for long periods of time. Improper hygiene, if you're not wiping the correct way. Most adults, especially adults that have had vaginas their whole lives, know that you have to wipe, right, front to back. But it's really common in young babies for especially their fathers not to know that when they're cleaning their babies, right? They have baby girls and they've had a penis their whole life and they're wiping their baby girls, changing their diapers. They don't know that you're not supposed to wipe up and pull the fecal matter from the back to the front. That can cause infections. Anything where GI material is getting into the urethra and vagina. Okay. Was that fun for everybody? Again, and this is typically not, bladder infections are not typically very serious infections, but if it does manage to travel to the kidneys, it can be life-threatening. So the treatment for this, for cystitis in particular, is usually oral antibiotics. Pyelonephritis, or kidney infections, are usually treated with IV antibiotics because it can be a much more serious infection. There's an episode of TV, I don't know if any of you have ever seen it. It's a ridiculous show. There's a show called Crazy Ex-Girlfriend where she gets a urinary tract infection. She sings a whole song about it. It's ridiculous. But she ends up in the hospital because she has a kidney infection. She thinks that she can chug cranberry juice and make it go away, and she ends up in the hospital, which is a relatively common thing to happen. And again, urinary tract infections are incredibly, incredibly, incredibly common. It's nothing to be ashamed of. Happens to everybody. Happens to most people at some point in their lives. I would say, like I said, I have no evidence to back this up, but I would bet, just based on my experience, that it's the most diagnosed infection, bacterial infection, worldwide. All right, our next one is bacterial vaginosis. And again, you can probably figure this out. We're playing this game with everything. You can probably figure out what this infection is. It's osis, inflammation of the vagina. Vaginosis, vaginal inflammation, caused by a bacteria, bacterial vaginosis. Bacterial vaginosis is caused by the bacteria Gardnerella vaginalis. Again, this is a bacteria. The signs and symptoms are itching, burning, excessive vaginal discharge is one of the major symptoms, and an unusual odor. It does cause odor in the vaginal tract, and there is an excessive amount of unusual discharge. This is a picture, if you've never seen a cervix that close, why would you? That is a picture of a human cervix, if you've ever seen it that close before. And all this white stuff is the abnormal discharge coming out of the cervix. And so bacterial vaginosis causes inflammation anywhere in the vaginal tract, from the cervix all the way through the vaginal tract. It can cause inflammation of the vulva as well. And transmission/prevention of this, it is an opportunistic pathogen. And what we mean by opportunistic pathogen is that it is a pathogen that is already present in the normal vaginal flora. So Gardnerella vaginalis is a bacteria that is part of the normal vaginal flora. And under normal circumstances, it is not going to cause any issues. However, if the vaginal tract microbiome is disrupted, that Gardnerella vaginalis can take over. It's an opportunist. It sees an opportunity and it takes it. And disruption of the vaginal microbiome can happen from a lot of different things. It can happen from sexual activity, right? Having somebody else's skin inside there can ruin, especially depending on what's on it. If somebody's wearing a condom with lubricants on it or a condom with spermicide on it, those are chemicals that can alter, not that you shouldn't wear condoms, but that can alter the vaginal pH. Washing it out with soap. You are not supposed to wash the inside of a vagina with soap. It ruins the microbiome. Douching, anything that's washing up there with any kind of chemical or soap can mess up the microbiome. There are some people that have very little control over this, and they get bacterial vaginosis every month when their hormones change, because the hormone fluctuations cause a disruption in their microbiome. And so they get an infection literally every month. Again, wearing clothing that's too tight, wearing bathing suits that are covered in chlorine for too long, wearing synthetic underwear, all different kinds of stuff. The vaginal microbiome is a very delicate place. And any little thing, any disruption to it can cause a disruption to the microbiome. And when that microbiome is disrupted, it can lead to bacterial vaginosis. Again, this is not a sexually transmitted infection. This is not something that one person spreads to another person, but sexual activity can exacerbate it, I guess, give it the opportunity to take over. And something kind of cool about bacterial vaginosis is something called clue cells. Now, why this is cool is because there are very few infections. We're going to talk about another one in just a little while. But there are very few infections that can be diagnosed by looking at one single gram stain, right? Most of these things, like you're like, yeah, I see some gram-negative bacteria, but you have to plate it, you have to identify it, right? You have to go through all the steps before saying, yes, this person has strep throat, or yes, this person has sepsis, right? There's lots and lots of steps. Bacterial vaginosis, Gardnerella vaginalis in particular, is one of the very few that can be diagnosed with 1 gram stain in 10 minutes. And that is because Gardnerella vaginalis, for whatever reason, forms something called clue cells. What a clue cell is it's basically an epithelial cell covered in bacteria. And an epithelial cell is just one of the cells of your epithelium, so the outer layer of your skin. And this is what a normal epithelial cell looks like. This is a normal, under a gram stain. It stains pink because human cells don't have cell walls. So it stains pink, and you can see its nucleus right there. It's a normal epithelial cell. And also notice that you can kind of see the clear edges. Like if I wanted to draw around this, I could draw very clear edges around that epithelial cell. But when it's covered in bacteria, this Gardnerella vaginalis, for whatever reason, sticks to the outside of epithelial cells. And so all this purple stuff is that gram-positive bacteria sticking to the outside of this epithelial cell. And notice that you can't see its nucleus anymore. There's not a very clear edge. It's all fuzzy, right? And this is a diagnostic finding for bacterial vaginosis. So if you get a gram stain of a vaginal tract and you see one clue cell, that is diagnostic for bacterial vaginosis, which is pretty cool. There aren't that many things that can be diagnosed that way with one single finding. And it's usually treated with oral or topical antibiotics. It's not typically considered a very serious infection. It doesn't typically travel to other parts of the body. It doesn't usually cause any symptoms outside of vaginal discomfort. It's annoying and frustrating, but it's not going to cause serious issues long term. And it can be kind of prevented or treated with probiotics. So anything that is going to support the chemistry of the vaginal microbiome and the bacteria that are supposed to live there. All right. Now we're going to talk about sexually transmitted infections. And keep in mind, again, bacterial vaginosis is not typically an STI. A lot of times it gets lumped in there with sexually transmitted infections, but it's not one. Sex can exacerbate it and make it worse, but it's not strictly an infection that is transmitted from person to person. Okay. Sexually transmitted infections are infections that are solely transmitted through sex, or sexual contact, I should say. And our biggest ones are going to be chlamydia, gonorrhea, and syphilis. And I just put this chart up here because I thought it was an interesting thing to look at. And I have some data that, of course, you don't have to write down, but I'm just going to say it. So in 2024, the combined total of number of cases of chlamydia, gonorrhea, and syphilis declined 9% from 2023, which is really, really good, right? So in general, the overall numbers of STIs are decreasing. They're on the downflow. However, there were still more than 2.2 million reported STIs, 2.2 million reported new STI infections in 2024 alone. And compared to a decade ago, so comparing it to 2023, we're down a little bit. Comparing it to a decade ago, we're up about 20%. So there's a severe increase in sexually transmitted infections from 10 years ago. And congenital syphilis, which is, we're going to talk about more in a little while, but congenital syphilis is syphilis that is transmitted from mother to newborn during birth. Congenital syphilis is up nearly 700% from 10 years ago. So it's jumped up 7 times, basically, is another way of saying that. And it's important to note that sexually transmitted infections, again, this is just one of those things I think are important for us to keep in mind and to think about as healthcare providers and just as people navigating the world, is that it's important to note that increases in STIs almost always affect lower income people at a much higher rate. So people who do not have access to healthcare, people who can't pay for healthcare, budget cuts, closing down free clinics like Planned Parenthood, mean that people who can't afford healthcare are not able to be treated for these infections. So something that might be a simple antibiotic prescription, I have access to healthcare. If I got chlamydia, I would go to my doctor and he'd give me one antibiotic prescription. I'd go to the doctor or go to the pharmacy. I'd probably pay about $11 for it, and I would be fine. And I wouldn't pass it on to anybody else that I came in contact with. However, people in lower income brackets cannot afford that. And so something that started out as one simple whoopsies, I had unprotected sex and now I have chlamydia, is something that can be spread to dozens more people, depending on the sexual habits of the person involved. And it also means that infants and newborns who have no say in this whatsoever, right? I mean, an argument can be made that sex is a choice for most people. But newborns and infants have no choice in the matter. And infants that are born to lower income families that cannot afford prenatal health care are at a much higher risk of getting congenital syphilis, congenital chlamydia, and congenital gonorrhea. These are all incredibly dangerous infections. And again, most of these are curable if they're treated. We have antibiotics. They're relatively cheap if you have health insurance. So it's just something to keep in mind from your viewpoint. I mean, I'm not going to make assumptions about any of your economic status, but for the most part, you guys are in college. You have access to tech care, if nothing else. So you have access at this point in your life to some amount of healthcare. Most of you do, maybe not all. But there will come a time in your life where you're going to have to pay for healthcare. Or you may be working at a hospital where people don't have healthcare. And it's really important to keep these things in mind. And when we're talking about, politics are hard for everybody. Everybody has different views. But things like closing Planned Parenthood on the outside, when you first look at that, Planned Parenthood is, a lot of people think of it as an abortion clinic. Right? Planned Parenthood's an abortion clinic. And if we shut down Planned Parenthood, then we're stopping abortions. And that I could see as thinking of that as a moral victory, right? We're stopping abortions, whether you agree with that or not. But the truth of it is that when you shut down places like Planned Parenthood, you're not just stopping abortions, you're stopping people who can't afford health care from spreading chlamydia and gonorrhea and syphilis. Because the truth is, people are not going to stop having sex. It's just not going to happen, right? And so preventing people who are having sex from getting health care is going to cause much bigger problems. And what's going to end up happening is that things like gonorrhea and chlamydia and syphilis are going to spread more rapidly through the entire country. And it's going to start spreading to infants and newborns. It already has at a much higher rate. And these are the types of things that are systemic problems that feed into a lot of different things. So it's not just about sex and chlamydia, right? Everything, and it's not just about abortions. It's a much bigger issue. And it's just important to keep that in mind as you go through life. I'm not trying to tell you what to think or what to believe, but I do think it's important to take a look at maybe a side that you haven't seen before. I know I've never been in a position where I didn't have health care. I've been very privileged in that way, but I think it's important to make sure that you're seeing it from that perspective, because there is a large portion of this country that falls into that bracket. Okay, so we're going to talk about these in kind of two groups. We're going to talk about this one first, are the STI discharge diseases, which is a very inelegant name. But it's named that because their primary symptoms is large amounts of discharge, particularly from the urethra or vaginal opening. So from the genital systems. And the two causative organisms of this are Chlamydia trachomatis, which causes chlamydia, and Neisseria gonorrhea, which causes gonorrhea. So again, the major symptoms of this, painful urination can be a symptom, but the biggest one is the yellowish discharge from the urethra or vaginal opening. And those are very common in both chlamydia and gonorrhea. But something that's really important to note about these sexually transmitted infections is they are very often asymptomatic, especially I don't want to say that, never mind. But they are very often asymptomatic in both males and females. I have written down, again, you don't have to write this down, but it's thought that anywhere from about 10% to 50%, so up to half of the people who have chlamydia, I was combining their names, chlamydia or gonorrhea are completely asymptomatic, which means they have no idea that they have it. So the transmission of chlamydia and gonorrhea is not always about, we like to put this villainous take on it, that if somebody gets chlamydia, it's because they had sex with somebody that was trying to trick them and they had no idea, or they knew and they didn't disclose it and they didn't want to wear a condom or whatever else it was. It's not always that simple. It's very possible that they have no idea. And it's very possible that the female had no idea. And you can go months and months and months and months and not have any idea that you have this, which is particularly why it's really important to get regular screenings if you are sexually active. Even if you're always really safe, even if you're always wearing condoms, no matter your gender, it's really important to get regularly screened. A lot of times, chlamydia and gonorrhea are found when the female partner goes to get an annual exam, because female partners, people with vaginas and uteruses, typically get checked out once a year, right? We have our annual fun time with a speculum. And so they're much more likely to go to the doctor on a regular basis than a genetic male, especially a young, healthy genetic male. But it is important for both parties who are having regular sexual activity to get screened. Because again, it's not always about like the villain, right? It's not about, oh, I'm hiding it, right? Sometimes you just don't know. And no matter how good of a person you are or how good you are at always wearing condoms and things like that, condoms are not foolproof and STIs are always possible. And so the responsible thing to do if you're having sex with multiple partners is getting screened often. And the biggest problem or long-term effect that can happen from these sexually transmitted infections, chlamydia and gonorrhea both, is something called PID. PID is called pelvic inflammatory disease. And this often happens when chlamydia and or gonorrhea are not treated. Like I kind of said before, these are typically very easily treated with a course of oral antibiotics. But if a person has no idea that they have it, they're not experiencing symptoms, and they're not getting checked, this bacteria can travel up into the rest of the genital system and cause infections higher up. And what can happen, particularly in genetic females or people with uteruses, but it can happen to any gender, is that there will be inflammation in any part of the pelvis, specifically the uterus. And so you can form scar tissue from inflammation in the fallopian tubes. You can form it in the lining of the uterus. In genetic males, it can happen in the vas deferens and in the urethra, and it can cause permanent infertility. This scar tissue is permanent. If PID gets bad enough, it can cause permanent infertility. Either the eggs can't get away from the ovaries, or the sperm can't get from the vas deferens or wherever the inflammation is. If the inflammation is in the body of the uterus, a lot of times an embryo won't be able to implant. So again, it's very important to get screened for these types of things so that you can be treated for them if you have them. Pelvic inflammatory disease is much more common the more often you have these infections. So having chlamydia 2 or 3 times is going to make you more likely to get PID than if you just have it once. And then sexual transmission is almost exclusively sexually transmitted or vertically. What we mean by vertically is from mother to infant, either during pregnancy or birth. And again, so I guess maybe a better way of saying that is that it's transmitted through direct contact of genitalia, whether that's genitalia because somebody is exiting your birth canal or because somebody is going into it. So sexually transmitted is most cases, but vertically means from mother to infant during either pregnancy or birth. And like I said before, PID is a significant cause of infertility. I have written down that it is estimated that in the US alone, over 6 million females, so in the US alone, as of 2024, 6 million females have impaired fertility, and the vast majority of those cases are thought to be caused by PID. So millions and millions and millions of people every year have fertility issues that could have been prevented if they had been treated for a sexually transmitted infection, or if they hadn't gotten it in the first place, if their partner had been screened before they had sex, or whatever else it is. Okay, so it's not, I feel like I have to strike a balance here between, because sex is not something to be ashamed of. It's something that most people do in their lifetime. Not everybody, but most people do it at some point in their lives. And it's nothing to be ashamed of, and wanting to have sex with multiple people is not something to be ashamed of. But it's also about having awareness of the risks, and that if you are going to choose to partake in those activities, that you protect yourself and you protect your partners. So again, I think it's important to kind of strike a balance. I'm not like shaming you into not having sex. That's not the point. It's not a shameful thing to do. But it is important that if you're, I'm going to sound like all of your moms, but if you're old enough to be having sex, you're old enough to be making the correct choices and preventing yourself from getting sick, or preventing your partners from getting sick. Right? Next we have syphilis. And syphilis is a tough one. For whatever reason, this bacteria doesn't have a name that says syphilis in it. But syphilis is an infection that is caused by Treponema pallidum, which is a bacteria. And syphilis is a very interesting infection because it has lots of different symptoms at different stages. But before we get to that, for centuries, syphilis was a common and devastating illness that killed millions of people per year. Again, since the beginning of time, people are not going to stop having sex. So it makes sense that one of the most devastating illnesses was something that was spread through sexual activity. Syphilis was actually one of the first illnesses to be successfully treated with antibiotics. One of the very, very first antibiotics, the first thing that it was used to treat was syphilis. And infections decreased significantly. However, since 2003, with the rise of drug-resistant infections and the decrease of accessible health care, so as antibiotic resistance goes up and access to health care, especially in the US, goes down, syphilis infections are on the rise again. And congenital syphilis, which is passed during pregnancy, can cause anything from a mild nasal discharge to bone deformations to miscarriage and stillbirth. And again, congenital syphilis is affecting a person that has no say in this matter, right? This wasn't a choice that they made. And not all adults who have sex make a choice, but the vast majority do. But that is syphilis. So syphilis has a lot of different stages. There's actually 4 stages to syphilis: primary, secondary, tertiary, and quaternary, but we're not going to talk about all of them. I just want to talk about 2 major symptoms associated with syphilis at different stages. So early stages of syphilis, the very first symptoms that somebody has of syphilis is something called a chancre. And a chancre is specifically this open wound that appears somewhere on the genital area. This one is very obvious. It's on the, right underneath the head of a penis. If it's gotten by a genetic male, a lot of times it's usually very obvious. It's somewhere on the shaft or the head of the penis. It can't be hidden. But in genetic females, the chancre can appear on the vulva, so it can be on the external part, but it can also be in the vagina, or it can be in the uterus, which obviously can't really be seen. So it's anywhere on the genital tract, and it is a single open wound. It's a very odd thing because it's just one. It's one sore. There's not usually multiple, and it appears somewhere on the genital area. Again, this may be somewhere where it's not visible, but it appears somewhere in the genital region. So that is a chancre. It's that open wound, and there's usually one. So it's a single open wound. And then the other symptom that occurs around the same time is this rash. And the rash usually occurs on the hands and feet. Most often on the hands, like the palms of your hands and the soles of your feet. So those are the primary symptoms of syphilis. But one of the reasons that syphilis is so dangerous is somebody can have these symptoms, these primary symptoms, and actually what is very normal in a syphilis infection is the syphilis basically goes dormant inside of your body. It goes to sleep, and these symptoms go away, but the syphilis is causing long-term damage inside the body that is not as visible. So the primary symptoms are very, very visible for the most part. They're very easily seen, and they're very recognizable. Not very many things cause a single open wound to appear on the head of a penis, right? That's a very specific symptom. But then the symptoms kind of go away, and the syphilis can go to sleep for decades. But late symptoms, so after, and what I mean by late is I mean many, many, many years later, what can happen is the syphilis will reemerge and cause much more severe and much more devastating infections and symptoms. And a lot of times this happens so long later that somebody might not even realize where it came from. This can happen 50 years later. And a person, I've been married for 40 years. I've only had sex with one person, or in the last 40 years, and it's because they had syphilis when they were 20 and didn't get it treated, and it went to sleep. And yes, they've been completely faithful to their wife or whatever for the last 40 years, but the syphilis reemerges when they're older. And the symptoms of late-stage syphilis, one of the most important symptoms is it can actually cause neurological damage. There is a specific type of neurological damage that can happen with late-stage syphilis. It can cause problems with walking. It makes walking very difficult. It causes motor difficulties, memory difficulties that can look a lot like Alzheimer's or dementia, but really it's just a bacterial infection. The bacteria have taken root in the brain. And again, this is passed through sexual contact or vertically, so from mother to infant. And its treatment is usually oral antibiotics if it's treated in the early stages. If a person has late-stage syphilis, the treatment is much more difficult. Okay, trying to remember how many more slides I have. All right, next we'll get through these next ones pretty quickly. So next we have genital herpes. We've talked about herpes before. We talked about oral herpes or cold sores, which is the nice name for them. But genital herpes are caused by the same virus. So it is caused by HSV 1 or 2, or 1 and or 2. And it can be caused by either. There is kind of I don't know if I want to call it a misnomer or a rumor or a myth, I guess, that HSV-1 only causes oral herpes and HSV-2 only causes genital herpes. So if you have, HSV-1, you're safe because that's only oral herpes, and that's not true. Both strains can cause either type. Okay, just depends on where you get it. The mucous membranes in your mouth are very similar to the ones in the genital area. So either one can infect either area. Signs and symptoms are very similar to oral herpes. I spared you the genital herpes, but this is what a genital herpes looks like, just on a vulva or a penis instead. It's tender, itchy papules, so these little pus-filled zit-like lesions that erupt and scab over on the genitals or around the mouth. Transmission prevention, it's direct contact with active lesions, including sexual contact. So again, most of the time if you're coming in contact with somebody's genitals, it's going to be sexual contact. I mean, there's not a whole lot of casual contact between genitals, right? But you can pass it. What I mean by direct contact is you can get oral herpes, or you can pass this virus by kissing somebody on the mouth or on their face. You can pass this to a baby by kissing their hands, and then the baby touches their face. You can share sodas, any type of direct contact with a lesion. So again, genital herpes most often happens because of direct genital contact. But again, if you have either type can cause either type. So somebody who has oral herpes, if their mouth comes in contact with somebody's genitalia, they can get genital herpes from somebody who has a cold sore. Yes, so it is estimated, this is an incredibly common infection. It is estimated that between 50 and 80% of adults in the US are positive for one strain or the other. Most of us have some type of herpes, whether we call it cold sores because it makes us feel better, because herpes has such a stigma to it, the name is attached to such a stigma. So whether we call it cold sores or we call it herpes, most of us have been exposed to this at some point in our lives. And it is important to note that HSV in newborns, so newborns and infants that get HSV, it's a significant cause of meningitis. Meningitis and death. So if you are a person that has cold sores, don't ever kiss a stranger's baby, don't kiss their hands, don't kiss their face, don't kiss anything on anybody else's baby. And if you are a person that has cold sores, don't kiss your baby if you have a cold sore. And HSV is incurable. Someone who is infected with it will be positive for the virus for the rest of their lives. So again, I'm a person that gets cold sores. I got them when I shared a soda with my brother when I was like 5 years old, and I will be positive for it for the rest of my life. I occasionally get cold sores. Mine are not that bad, but it's just the way that it is. You'll always be positive for it. All right, and then our last one is genital warts. And genital warts are caused by the human papillomavirus. Another name for a wart is a papilloma. So human papillomavirus, human genital wart virus. And signs and symptoms, genital warts are specifically outgrowths of tissue on the genitals. So everybody's seen a wart before, but these are just little outgrowths of skin. They don't typically itch or hurt in any way. They're just these little outgrowths on the skin. However, HPV infections are often asymptomatic. And HPV, there are actually over 100 different strains. Some are more known for causing certain types of infections than others. But HPV, there's a couple of reasons why, but HPV is by far the most prevalent sexually transmitted infection in the US. The CDC states that nearly all sexually active adults will get HPV at some point in their lives. And there's a couple of reasons for that. The first one is because it's so prevalent. Because basically everybody has it, you're more likely to get it. Okay? If everybody's got it, it makes it way more likely that it is going to be spread if everybody has it. The other reason that it's so common is that it's spread through sexual contact. Again, people are never gonna stop having sex. But the biggest problem with HPV is it can spread even with condom use. And the reason for that is because and again, I'm gonna try not to be gross, but HPV is spread through fluids. And if it's like a female partner that has it, vaginal fluids don't always stay on a condom, okay? A lot of times during sexual activity, there's a lot of it, and it doesn't stay where the condom is. Typically, the male partner's fluids will stay inside of a condom if it's used properly, but the female partner's doesn't always. So you can get HPV while using a condom. And so that's a part of why it's so prevalent. Most of us think, oh, if I'm using a condom, I'm being safe. And it's not always safe. And another reason that it's so prevalent is because males cannot be easily tested. So HPV, females can be tested for HPV, right? They're tested for when you have your annual pap smear. It gets picked up when you take a little chunk of your cervix. But male partners cannot be easily tested for HPV. So HPV is so common because even if you're doing all the right things, even if you're being selective about your partners, even if you're getting tested regularly, even if you're using condoms, even if you're doing everything right, the chances of getting HPV are still relatively high. And the biggest problem with HPV isn't the warts. The biggest problem is that certain strains of HPV can cause cancer of the cervix, vulva, urethra, testes, anus, mouth, throat, anything with a mucous membrane. You can get cancer from HPV. So, and that's a really serious thing, which is why, again, even if you are doing all of the things right, even if you are protecting yourself, even if you are using condoms regularly, all that stuff, it's really important that the female partner in particular is getting tested for HPV regularly, because you are the one that is more likely to get cancer from that. And it's really hard to prevent you from getting it, but it is relatively easy. It's not easy, but you can stop yourself from getting cancer. And there's also a vaccine available for this. It's relatively new. When I was young, there was no vaccine available. I remember it became available just as I was too old. It was like, you can only get it if you're less than like 19 years old or something, and I think I was like 22 at the time. But there is a vaccine available that tends to prevent infections and prevents cancer from happening. But that is genital warts. Okay, we made it. All right, I will see all of you on Wednesday for your exam.